Hello doctors. Today our topic of discussion is branches of subclavian artery and circle of Willis. If you have not seen the previous video on the carotid arteries, then kindly do go and watch. It will be easier for you to understand the circle of Willis. So starting with the subclavian artery, over the right side the subclavian artery is arising from the brachiocephalic artery, and over the left side the subclavian artery is directly arising from the arch of aorta. So the course of the subclavian artery. Each artery arises laterally from the sternoclavicular joint to outer border of the first rib, where it ends and continues as the axillary artery. The scalenus anterior muscle crosses the artery anteriorly and divides into three parts. Here we can see this is the scalenus anterior muscle, and it is dividing the subclavian artery into first part, second part and the third part. So the first part is medial to the anterior, scalenus anterior. Second part is posterior to the scalenus anterior, and the third part is lateral to the scalenus anterior. Now this is the subclavian artery and the branch. The subclavian artery is divided, as I have said, first part, second part and the third part. The first part have three branches. One is the vertebral artery, thyrocervical artery, internal thoracic artery. Here we can see that in the diagram. Second part have one artery, costocervical trunk, which is known as, and the third part have dorsal scapular artery, which is occasionally present, and after the first rib it continues as an axillary artery. The thyrocervical trunk. The thyrocervical trunk, which I have said, the first part of the subclavian artery have three branches. Number one is the suprascapular artery, number second is the transverse cervical artery, and number third is the inferior thyroid artery, which supplies the thyroid gland. Now we will see the costocervical trunk. Costocervical trunk, as I have said, is arising from the second part of the subclavian artery. It has two branches. This is the costocervical trunk, and this costocervical trunk, below this is the intercostal artery, which descends in front of the neck of the first rib and divide into first and second posterior intercostal artery, and above this is the deep cervical artery. So this is the branches of the costocervical trunk. Now we will see the vertebral artery. Vertebral artery is arising from the first part of the subclavian artery. Vertebral artery can be divided into four parts. This is the first part, second part, third part and the fourth part. The first part doesn't give any branches. The second part, which runs through the foramina transverse area of upper six cervical vertebra, this is the foramina transverse area of the upper six cervical vertebra, and give branches, spinal branches, and it reaches up to the atlas. After the atlas, the third part arises and lies in the suboccipital triangle, and it gives muscular branches to the suboccipital muscles. Now the fourth part gives the cranial branches, and this is important. And cranial branches are five: meningeal branches, medullary arteries, anterior spinal artery, posterior spinal artery, and the posterior inferior cerebellar artery. Now we will go to the circle of Willis. As I have said, the circle of Willis is an arterial circle which is situated at the base of the brain in interpeduncular fossa. Here we can see this is the internal carotid artery. Internal carotid artery have middle cerebral artery and giving the anterior cerebral artery. So middle and anterior cerebral artery is a branch of internal carotid artery, and two anterior cerebral artery are communicating by anterior communicating artery, and the posterior cerebral artery arising from the basilar artery. From where the basilar artery came, as we have said, the vertebral artery is the first branch of the subclavian artery. Two vertebral artery join to form the basilar artery, and the basilar artery give branch, that is superior cerebellar artery, posterior cerebral artery, and the anterior inferior cerebral artery. So the anterior inferior cerebral artery is a branch of basilar artery. The posterior inferior cerebellar artery is the branch of the vertebral artery, and the anterior and posterior spinal artery is also the branch of the vertebral artery. So here we can see the middle cerebral artery and the posterior cerebral artery. Middle cerebral artery is a branch of the internal carotid artery, and the posterior cerebral artery is the branch of the basilar artery, which is joined by the posterior communicating artery on the same side. Now we will see the clinical appliance of the circle of Willis. In the clinical appliance of circle of Willis, we will see the Berry's aneurysm. What is Berry's aneurysm? Berry's aneurysm is a blood-filled sac that bulges from the weakened artery in the brain. Most common site of Berry's aneurysm is the anterior communicating artery, and the second most common site is middle cerebral artery. A rupture in Berry's aneurysm is a medical emergency and can cause sudden severe headache, often described as worst headache of the patient, with stiffness of neck, nausea, vomiting and loss of consciousness. Thank you everyone for watching this video. In our next video, we will discuss about the axillary artery and its branches. If you like this video, please do like, share and subscribe.